Welcome to this clinical walkthrough for the UKMLA. Today, we're going to break down a super common dermatology case, cherry angiomas. Let's get you ready to ace this station.
Okay, let's set the scene. Your patient is a 65-year-old man, and he opens the consultation with this statement. Pay close attention because what he says right here is your first big clue.
Did you catch that? The key phrase is spreading now. That's the trigger. That's why he's in your office today, and it points you straight to his main concern. This is your cue to launch into a really well-structured consultation, starting with your introduction and history.
All right, Section 1, Introduction and History Taking. Look, in an OSCE station, how you start is everything. A calm, professional introduction doesn't just put the patient at ease, it shows the examiner you have a clear plan from the get-go. Use this exact phrase. Don't improvise. It's polite, professional, and gathers the essential info you need. Once you've done that, your history taking needs to be logical and super efficient. For a skin lesion case like this, I want you to think of it in 3 simple parts.
This is your roadmap. Lesion questions, PMA ptosa, and ice. Following this structure means you will not miss a thing. So you'll start by digging into the lesion itself, then zoom out to get the bigger picture with PMA ptosa, and finally get into the patient's head with ice. So let's kick off with those lesion-specific questions.
These are your bread-and-butter diagnostic questions. You're basically hunting for red flags. Has anything changed? Size, shape, or color? Is there any pain, itching, or bleeding? If the answer is no change, that's a good sign, pointing towards something benign. But if there are rapid changes, your alarm bells should start ringing. After you've got these details, you broaden your scope with PM-FTCOS, that's past medical history, medications, and so on, to understand the patient's wider health. In this case, the key findings are:
Okay, the absolute standout point here is retired firefighter. Ding, ding, ding. That just screams significant long-term sun exposure, a major risk factor for all sorts of skin conditions. So, now that you've gathered your clinical data, it's time to explore the patient's perspective using ice.
Listen, whatever you do, do not skip ice. It's a classic mistake, and it's a massive fail in the UKMLA. Addressing the patient's ideas, concerns, and expectations shows you're a caring, patient-centered doctor. You have to know what they're thinking to give them the reassurance they need. And this patient has some pretty specific thoughts.
See that? His number one concern is that this might be something serious. That becomes your primary target for reassurance. Knowing his ideas and expectations is gold. It helps you tailor your entire management plan. With a full history in the back, it's time to move on to the examination. Section 2, Examination and Findings. Now, first rule of business, always get consent before you examine. And when you describe what you see, you need to say it out loud, clearly, and systematically for both the patient and the examiner. A great way to phrase it is,
That's perfect. It beautifully illustrates the classic features. You've described what you do see, bright red, dome-shaped, and just as importantly, what you don't see, no ulceration, no irregular borders. This description, combined with the history, points you strongly towards one specific diagnosis.
Okay, Section 3, Diagnosis and Explanation. It's time to deliver your diagnosis. The key here is to do it with confidence and without a ton of medical jargon. And you must link it directly back to what you've seen and what the patient told you. That's how you build trust.
This phrasing is exactly what you should use. It's direct, it's clear, and it shows you've based your conclusion on the evidence. Your very next move is to immediately explain what that means in simple, easy-to-understand language.
This explanation is brilliant because it does 2 things at once. First, it explains what they are, just small overgrowths of blood vessels. But more importantly, it directly tackles the patient's main concern from ice. That word benign is the single most powerful piece of reassurance you can give him.
And you can practice this exact case right now. Get objective feedback on mymediate.com. There's no substitute for actually running through the scenario yourself to really lock it in. Okay, let's get back to the consultation. All right, Section 4, Management and Safety Netting. So, you've delivered the diagnosis and given that crucial initial reassurance. Now you transition smoothly into the management plan. This needs to include practical advice and, most importantly, your safety netting advice. So, you explain that no specific treatment is needed, but he should try to avoid scratching or scrubbing the spots. Using a gentle moisturizer and wearing loose clothing will also help prevent any irritation. Simple advice. And remember, you also have to manage his expectations about removal, which came up in his IC.
Being transparent here is key.
You need to state clearly that cosmetic removal isn't covered by the NHS, but a private dermatology referral is always an option. This gives him control. Now, for the most important part of your management plan, safety netting. You have to empower the patient to know exactly when they should seek help. These are the red flags.
Be explicit about these. Giving the patient clear, unambiguous instructions on what to watch for is a cornerstone of safe medical practice, and it will score you highly. Once you've laid out this crucial safety net, you're ready to close the consultation.
And finally, Section 5, closing the consultation. A good closing is clean and professional. You summarize the plan, check for understanding, and provide resources. You want the patient to leave feeling supported and knowing exactly what the plan is.
Explaining that no routine follow-up is needed helps reinforce the benign nature of the diagnosis. And offering a patient leaflet is a great move. It backs up your advice and allows the patient to review the information in their own time.
And that's how you structure a high-scoring consultation for cherry angiomas. By following these steps, you can confidently navigate this common OSCE station. And remember, you can practice this exact case now on mymed8.com. Good luck with your preparation.